So today we're going to talk about common sports injuries. Since this is a Zoom discussion, we're going to try to see if anybody has any questions in between. I give you permission to talk up. We'll know, and I'll stop, and we'll listen to what the questions rather than wait to the end. It can be done either way, but I like people to be able to ask questions. I think it's a better way to have these discussions. For those of you that don't know me, I'm an orthopedic surgeon. I've been in the Newburgh area, New Windsor area for about a quarter of a century plus. I was with orthopedic and sports medicine for about 23 years, or 24 years, 2 years with Crystal Run, and now I'm with Middletown Medical. As far as sports background, I take care of a bunch of the local teams. I've been Walk Hill team physician for about 25 years, Hudson Valley Renegades for about 25 years, and I take care of a couple of other teams locally on and off, some of the other sports teams, including Storm King. I basically their team physician as well, and some of the other schools. I did my fellowship at Johns Hopkins, and there I worked with the fellowship director, Charles Silverstein, who was the team physician for the Baltimore Orioles, and that's when I started to get interested in baseball. I was there for 2 seasons, and then I came up here and then quickly added on to the Hudson Valley Renegades, which was originally Texas Rangers, and then switched over to Tampa Bay, and as some of you might know, will be the Yankees farm team this summer. So we're going to get started. So sports injuries, basically there's adult and children's injuries, and we'll talk about both. You know, some of the questions are, when do you go see the doctor, and what options do we have to treat? Boomeritis, that's the older population, as you all know. And the same idea is how do we prevent sports injuries? So what's an orthopedic surgeon? That's a doctor who specializes in the treatment of health maintenance of musculoskeletal systems. So bone, joints, ligaments, muscles, tendons, cartilage, and spine. And basically it could be all the bones till you get to the up in the jaws and the skull. But we all specialize these days. So you have different subspecialties. Mine are more of a shoulder and knee, although I do take care of fractures of the long bones, so that, you know, the tibia, the femur, humerus, those types of fractures, even wrists. This is just, this slide, by the way, is from the American Academy of Orthopedic Surgeons. They sort of prepared this. So they want to tout themselves a little bit, or ourselves a little bit. So that you see that word expert a few times. Yes, we are experts in the musculoskeletal system, but that's not I wouldn't throw that word out so easily. In general, education for a regular orthopedic surgeon, you've got your 4 years of college, 4 years of medical school, 1 year of internship, 4 years of residency, and most of us do a fellowship. So that's 14 years. I don't count the extra 5 years I did getting my other 3 degrees, including a doctorate in science education. So for me, it was 19. As far as what we do, we diagnose and treat the musculoskeletal injuries. All right, and so how do we treat? In general, there's different treatments: medication, physical therapy, exercise, brace, and surgery. And does anyone know the orthopedic 4-letter word for treatment for this, when especially sports injuries? So a lot of you on mute, I'll answer. It's called REST, R-E-S-T. That's the 4-letter word. When I have an athlete who comes in here, if I say that, if I use that as a word for treatment, I get this very strange look. So I call that the orthopedic 4-letter word. All right. Prevention, though, that's something that we also work on, and I think it's very important. One of the areas where we as orthopedic surgeons were very poor at years ago when I got started, and are very good at now, is when we see somebody with a fracture, or even beforehand, when we see them for anything, we talk about preventing osteoporosis, for instance. So for instance, somebody comes in with a wrist fracture, a female patient in general, a lot of times it's female more than male, in their 50s, you know, have they had a bone density study? If not, you get that, or a vitamin D level. I can tell you here as far as probably in this area, probably 50% of people are vitamin D deficient. It's just that how do you get vitamin D? I think a lot of you know this. We used to get it by being in the sun and working outside. Vitamin D is needed to create, to help absorb calcium into your bones. So if we're inside all the time and not outside, or where somebody says, don't go in the sun, you'll get cancer, skin cancer, we protect ourselves so we don't get vitamin D from our natural source, which is the sun, so we have to take it in our diet. Somebody got smart years ago and put it in milk for kids, but a lot of people don't drink milk, and so you have to get it through taking pills. Rarely you can get it in the diet. But by doing that, you might prevent a fracture later on in life. Why musculoskeletal problems? So musculoskeletal conditions affect hundreds of millions of people. About half of all chronic conditions in people over 50 are musculoskeletal problems. So it's quite a lot. And so what are the goals? To improve quality of life for people who have pain from these injuries, and to enhance education, advance treatment through research. Injuries. We're getting a little feedback. Maybe we can mute for a little bit. Unless you want to speak, then unmute. So simple precautions keep sports fun, all right? There's two types of injuries that are very common. One's an acute injury, which is sudden trauma, sprains, bruises, fractures, and then an overuse injury, which is repetitive injuries. So those are the two common. So somebody comes up and says, I've been diagnosed with a rotator cuff tear. How did that happen? So it could have happened from something acute, something happened, they lifted something too heavy, or it could be overuse. So a lot of tennis overheads or something like that can cause that. Basketball is 412,000. Baseball and softball is 276,000. Soccer 220, and playground injuries are 410 or 411,000. Young athletes are not small adults. They're different. So in the film, in the image that says adult is different than the image that says child by the lines that go across there. Those are called the growth plates. So you've got a growth plate of the distal femur and a growth plate of the proximal tibia and the fibula. There's 3 growth plates there. You have a pointer by any chance, or what will make a difference?
I do one.
Oh, no, yes. Okay. And obviously, use of the same age can be different sizes. So in a football, you can have a large person knocking down a small person, and that obviously could cause more injury of that small person. So when do you want to see a physician versus rest and let it get better yourself? Obviously, if you can't do your sports or have a decreased ability to play, if you're limping, loss of motion, swelling, those are all reasons to see a physician. Visible deformity and severe pain. Now, if you just have some injury and you want to give it a day or two and it's not swollen or red or deformed, that's reasonable. You would ice it, elevate it, maybe a compression wrap, and if it doesn't get better, then go see a doctor. But if you can't walk without crutches, you might be willing to see the orthopedist sooner. Before you go to see the doctor, if you can get some information, that'll make your day easier. So you prepare yourself, you describe your symptoms, you know what you're going to say, get your medical history, list the medications, write down your concerns and questions. That makes so you don't leave, and then all of a sudden, the minute you left, you realize that you didn't ask a question or two. During your appointments, you want to you want to know what you're going to get from the treatment. This is communication between yourself and the physician. Treatment, how is it going to affect my daily activities, and how do I prevent from getting worse? So I alluded to earlier, rest, ice, compression, and elevation is for the sprain. As soon as you do that, as soon as you do it like an ACE wrap around the sprain, the faster the swelling will stay down. Swelling inhibits recovery. So you really want to get to it quickly. Elevation, for instance, if it's an ankle, you want to elevate above your heart. So you want to lift it so that it's higher than the heart. So just even putting on a stool is not higher than the heart, but it's better than sitting on the floor or walking around. Again, your recovery will be faster. So if you can adjust things right away when you first injure yourself, you'll have a much faster recovery. Obviously, if you're injured, you have to modify the athletic activity. Now, for a lot of the athletes we have, that doesn't mean they have to stop their sports. You can find something else in your sport that you can do that will make you better. For instance, if you have some overhead problems in tennis, maybe you can work on your backhand or your forehand. As long as you have no pain, that's a good way to do that. And so if you sports have a right-handed and left-sided, and you've got something going on with it, why not work on your other side? Basketball, work on your left layup or something if your right arm is in trouble. Or same thing with soccer, use your other foot if you can, work on the other side. So boomeratis, if you were born between 1946 and 1964, you're officially a boomer. All right, and that age group, there's more than 1 million sports-related injuries each year, which is quite a lot. Even though exercise is important, sometimes exercise can cause the injuries. Bike accidents, for instance, are high. Mortality, unfortunately, is higher in this age group than in children's injuries. Less than 50% wear helmets when they do biking. and something as simple as that can prevent either mortality or a head injury, something that could be crucial in your quality of life from then on. So 4 main things: tendonitis, bursitis, sprains, and strains. The difference between a sprain and a strain is a muscle injury and a sprain is a ligament injury. And we can get into that in a little bit. Tendonitis is inflammation where the tendon attaches, and bursa is an area around the tendon in certain joints that have a capacity to form fluid sacs. A lot of people might see people with the elbow, the olecranon bursitis, like a big round thing around their elbow. That's a common one that people see, but you can get them where you can't see, such as the shoulder has bursitis, and certain parts of the knee have bursitis. People who kneel can get what's called occupational bursitis around their knees, and they can get some swelling there. With treatment, again, we talked about that. The Rice originally, alter, stop your activities, physical therapy, medication, and maybe surgery. So preventing sports injuries. It's always better to prevent an injury than to treat the injury. And so wearing appropriate gear helps, playing on safe surfaces, and then for children, they should be trained before they start playing their sport. And also, kids should be well coached and supervised. So coaching, we'll talk about these things, but the classic example I find is in baseball thrower injuries. Even with a good coach, some kids may be playing 2 or 3 different leagues, and the coaches may not know that. And they get overuse injuries playing in multiple leagues. I see that all the time. Pitch counts are really important, but the coaches need to ask those questions. Are they playing elsewhere? So preventing injuries, knowing the rules and abiding by them, wearing your protective gear, knowing how to use equipment, and okay, never play through pain. So when someone goes to the gym and someone says, oh, you have to have pain, that's one of the biggest lessons that create injuries, is that it's okay to have a little muscle soreness when you're working a muscle for the first time. And that's okay when you, especially if you do it slowly and gradually. But that's the only type of pain that's okay. And we're talking about a little muscle soreness. If you do something and you have pain, you've got to stop and you got to rest and come to see your doctor, because if you keep doing it, it'll just delay the recovery or maybe prevent the recovery. Make sure if you have children or grandchildren who are playing sports, find out if the coach knows what they're doing, because that's how a lot of injuries occur. All right, it says make sure your young athletes warm up first, but this is for any athlete. You want to stretch and warm up so you don't pull a muscle. It actually happens more with older athletes. Younger athletes seem to get away with it a little more, but still it's an important lesson to learn right from the beginning, and it may prevent an injury. Obviously, we talked about the skilled instruction, safety gear, and then year-round conditioning. The weekend warrior. All right, so that's a lot when people all day long, all week long, they don't do anything. They go out and play, innings and innings of softball, or they go out and do that, and that's you're out of shape, and that's when a lot of injuries occur. You want to stay in shape all the time. You don't want to just do it a certain time or during a certain season. And if you are a seasonal athlete, prepare for that season ahead of time. So stretching, you want to warm up. When you warm up, you really should break a sweat. Then you know that you're doing a proper warm up. You can march, walk in place, jumping jacks, or mimic the sport you're about to do. Stretching, you don't feel pain. I'll say a little exception. When you stretch your hamstring, and especially, or your gastrocs muscles by bringing your hand, touching the ground, for a second, you can feel a touch, a twinge, a little bit of something, a little burn. Then you know you're stretching, but it shouldn't hurt. Hold the stretch for 30 seconds and then relax. Don't bounce, just sort of go slowly in your stretches. You want to breathe deeply and slowly. You avoid bouncing and stretch both sides. Okay, so let's go into some common, any questions? So common sports injuries, the ligament sprain. So you've got, basically there are ligaments on both sides of the ankle. The outside of the ankle is the one that's most commonly injured. You can see in this picture, there's two ligaments that are injured. One's the one on top, it's called the anterior talar fibula, and the ones on the bottom called the calcaneal fibula. Those are the ones that are just most commonly injured. And you'll be, if you're going to diagnose yourself, you'll be tender there in those spots in the soft areas. If you're tender over the bone, it could be a fracture. But if you're tender right in front, below the bone in those spots, then you probably have an ankle sprain. Now you can also go to the other side and feel, if you're tender on the medial side, then it's more of a sprain. And if you're tender a little higher up between the bones, the tibia and the fibula, again, that's a bigger sprain. And those sprains take longer to heal. And sometimes if you're tender in 3 spots, you need to be immobilized, braced, or even casted sometimes. And obviously, sometimes you need surgery for fractures. So children's, they have, a lot of children have growth plate injuries because that's the weakest spot where the growth plate line is. So this shows you a combination of a fracture through the growth plate and into the bone above and below. The growth plate in this case is the part that's closer to the carpal bones in the wrist. That's the growth plate area. And there's a fracture on both sides through the growth plate and then on the other side of the wrist in this one. Same treatment always, ice elevation, compression, and then rehab, range of motion, strength and stability, and I'm glad Will's here. Bracing is really important for ankle braces, and Will Thorpe got me to switch from the old ankle stirrup to the lace-up ankle brace. So and he's helped me out a lot with our bracing, and we can thank him for that. Why do you wear an ankle brace for when you sprain your ankle? It's prevent re-injury, and if you re-injure it, it's just going to take longer to heal. So you want to put that on so that you don't keep twisting it. You don't step on the curb and twist it when you step on the curb until it's healed. Once it's healed, you want to work on your muscles, or even before it's healed, because your ligaments around the ankle, one of them is called the peroneal brevis muscle, that can replace a weak ligament. The ligaments take a lot longer than the 6-week healing time to heal. And if you can strengthen the muscle, the tendon in the muscle, that can act to substitute that ligament that's weak, and that will help you prevent another injury. Plantar fasciitis, another injury. That's where the bottom of the foot, the fascia, the material in the bottom of the foot attaches to the heel, and you have pain there. Most of the time you'll have pain when you first wake up, the treatment for this is usually simple. It's just mainly it's stretching, That often solves the problem. You can see this person is stretching their toes up. You can step on the bottom step of your stairs in the house and let the heel go below. That's a great stretch. You can go against the wall. And that will stretch us. And I tell people who have this, if you stretch, especially before you go to bed and the first thing in the morning, that's because when it gets tight, that helps. There's also a brace that you can use. Let me just see if it's here. Night splinting. So there's a brace you put on at nighttime that stretches you all night long. All right. And a lot of times, if you use all these treatments, you don't need the next steps, which are invasive. So ice can help. Anti-inflammatories can help. If you have a weak arch, sometimes an orthotic inside your shoes helps. You can avoid the activities. It says, see your physician if pain's present. What's your physician going to do? It doesn't tell you in these pictures, in these slides. Some people use cortisone injections. Some people use laser treatments. Some people use PRP, which is platelets these days. And then sometimes surgery is needed. But most of the time with stretching and these other modalities, you can get better. And physical therapy is sometimes helpful also. Next one is tennis elbow. Now, most people who have tennis elbow don't play tennis. And tennis elbow, though, is the name of people who are bad tennis players that use their wrist instead of using their whole forearm and body. So what it is it's called lateral epicondylitis is another name for it. The wrist extensor attaches over here on the outside of your arm, and you're just using it too much. The golfer's elbow is the opposite, and it's too much flexion. And again, bad golfers tend to get medial epicondylitis when they're doing too much of the wrist flexion. And so it got the names golfer's elbow and tennis elbows. How do you prevent it? Stretching. So I have a little bit of tennis elbow at times, and my treatment is just this. I bring my elbow straight, I put my wrist down, and I stretch. All right, and whenever I start to feel it, I just do the stretch, and it tends to get better. All right, I'm lucky. I know exactly what it is when it starts to happen, and I just immediately do the stretching, and within a few days, it's gone. Ice therapy helps. You can take a styrofoam cup, put water in it, freeze it, take it out, peel off the top, and give yourself an ice massage. That helps also. There's also braces that help. I'm just going to see before we go on. There's a tennis elbow brace, a little strap that goes like this. It just changes the forces. And also you can use like a wrist brace. It prevents you from doing this and it makes you move your forearm. So those are things that can help tennis elbow. They can also help golfer's elbow as well. All right, and then take a lesson. Yes, if you can improve your technique, you may not get it. Sometimes changing the string tension in the tennis racket makes a difference. A little larger grip on the tennis racket makes a difference as well. There are little things you can do. Something to dampen vibration on the racket itself. ACL injuries, not so common, but they're devastating when it happens. And it usually can occur with a direct blow or a planting and twisting injury or hyperextension injury. There are lots of different ways that it can occur. How do you prevent that? That's really hard. Let's see. They've done some studies to show that females more than males have, when they jump, have a different way of landing, and that makes them more susceptible. So they actually will teach young women in sports like basketball on the college teams ways to work on that, and that may prevent ACLs. Working on the quads a little bit, strengthening, and how to actually do that. Okay, so this is an example of a patient who tore their ACL. You can see the anterior cruciate ligament. They're called cruciate because they cross. So the two ligaments, one's the one in the front, anterior, one the one in the back, posterior, they cross over. That's why they're called cruciate ligaments. The one that most commonly gets injured is the anterior cruciate ligament. They have football players who play with PCL injuries and they keep playing professional football. So that one usually is not as important as the anterior cruciate ligament. That one rarely gets fixed, but occasionally it does. Women athletes have a higher incidence than men in ACLs. It's a lot of factors. This neuromuscular prevention program is what I was talking about. Meniscus tears. Meniscus is the cartilage inside the knee. They're like little washers inside, and they help protect the knee basically from arthritis. They're very commonly injured in twisting injury. The football and clipping injury, those are meniscus and ACL injuries, and also MCL injuries. Pain, giving way, locking, clicking, swelling, these are common signs of a meniscus tear. We're moving quickly. Anyone have any questions on these before we go upper extremities? Okay, shoulder dislocation. All right, so it can happen in different sports. Maybe this is karate, but in judo, which is my sport, you fall, land on your shoulder, and it can pop out that way, or you can get what's called an AC sprain. If you've dislocated your shoulder, not everybody needs surgery. There's a little controversy behind this. There was a study out of West Point, our local sports place, that they did arthroscopic surgery on a lot of first-time dislocators, which was unheard of at the time. And there used to be, for West Point, these are cadets who were going into training. They used to have, when they dislocated, up to a 50% dislocation rate later on. And you don't want to have that if you're in the middle of a battle or doing some unsafe training exercise up on a height. So they decided to operate on people immediately, and that changed it to only like a 10 or 15% redislocation rate by operating right away. In the past, they would wait until you dislocated a second or third time. So we learned a lot from that study. Still, some people will wait because if it depends on your age group. If you're 20 years old and dislocate the first time, you may have anywhere from a 50% chance or maybe less, 20 to 50% chance of redislocating. But if you're 50 and you first dislocate, you really only have a 20% chance of redislocating. So the different age groups. So if it dislocates and you tear the cartilage around your shoulder called the labrum, you have other things to protect you. One thing is called the rotator cuff muscle. That's called the dynamic stabilizer, and you can strengthen those muscles, and that can prevent a lot of people from dislocating again. Obviously, surgery works also. Not everybody wants that as their first choice, although if you're a young 20-year-old athlete, that may be the best first choice for you. Overuse injuries, we talked about that when we first started. Tendonitis, a lot of weightlifters just do too much. They don't listen to they listen to the person that said no pain, no gain. Well, that's not true really. That's how you can get the tendinitises. If you can stop and rest immediately when you start to get that type of tendinitis, often it'll go away and you won't have a future problem. Interesting with the shoulder is that the shoulder, the rotator cuff, is a depressor. It keeps the shoulder down, and when it's weak, it elevates, and if it elevates, it can rub more. So by doing rotator cuff exercises, that helps. Every professional pitcher in the country does rotator cuff exercise with 2 or 3 pound weights. Some of these guys can bench press 200 pounds, but with these lighter weights, they do these exercises and they protect their shoulders, and there have been a lot less injuries since they do that. And now they've realized that, so now the other athletes, the catchers and the other throwing athletes do that as well. Same with the tennis players, professional tennis players. Everybody's doing those exercises to protect themselves from injury. So proper technique for the throwing shoulder, just lifting the arm up a little bit more as opposed to being down this way can prevent injuries. Pitchers like Nolan Ryan, who pitched into his 40s, he had perfect technique, and that's probably why he could do it so well without injury. So getting the proper technique, and instead of just training your shoulder, it's called core strengthening. You train your entire body, and that also prevents injuries. Rotator cuff tears. All right, so that again, those are, as I said again in the beginning, acute or overuse injuries. Anything that involves repetitive overhead motion can end up being a rotator cuff tear. It is very common. Can people get better without surgery? Maybe. It depends. There are people who have rotator cuff tears that have no pain and full function. And they have usually what's called a stable tear. It's a U-shaped tear, and they don't even know they have a tear sometimes. And so that's, you don't have to fix every rotator cuff tear. However, if you can't lift your arm up because your rotator cuff is torn, then that's a reason to consider getting your shoulder operated on. Some people say try therapy first, which is reasonable, unless you have an acute traumatic event. If you have trauma and you can't lift your arm up, it's likely that that you're not going to be one of those people that get better with exercise. And doing exercise for 4 months and then having the surgery and then being out for 4 months, because it can be a long time, especially if you're in an activity that does lifting, that can be devastating for some people. So that type of group often has surgery a little sooner. Stress fractures. So stress fractures occur in different populations. The Army recruit who all of a sudden trains really hard, there's a high incidence of stress fractures in that group because their body is not prepared, and it's an imbalance between bone loss and bone replacement, and it just happens really quick. Little tiny cracks, pain, and if you ignore it, you'll get real fractures, which is devastating. In the older age group, you can get it also. There's osteoporotic people can get stress fractures a lot easier as well. So that's something to get. And then there's something called the female triad, where young women who are amenorrheic, exercise a lot, and maybe don't eat a lot to try to keep their weight down. They have a high incidence of stress fractures. So again, what do you do to determine what is wrong? History is really important, listening to the patient and doing a physical exam. X-rays are sometimes helpful, but for a stress fracture, they may be normal X-rays. So if you suspect that, you can get an MRI. MRIs are beautiful. They used to have something called the bone scan, which was a nuclear injection, but now MRIs are better, and they'll tell you whether you have that particular injury. MRIs are helpful in a lot of things. Unfortunately, insurance companies don't let you get an MRI and everything, so you may have to start with some therapy before the insurance company will allow that. We're finding the insurance companies all the time to try to get the right tests for our patients. So what do you do to treat with overuse injuries? You reduce your intensity, you warm up beforehand, you ice afterwards, and again, you work on your technique. There's the 10% rule. Don't increase activities more than 10% per week. And then if you're going to talk about surgery, you want to ask the questions, obviously, why, what are the alternatives, and what are the benefits, and for how long do you have those benefits for? You want to ask about risks. You want to know what the procedure is called so that you can go online and look it up and even ask more questions, which I always encourage. You want to know how is it performed? Is it open? Is it arthroscopic? And you want to know what are the results. I can tell you in the world's best surgeons' hands, you've got an 80% success rate in a rotator cuff surgery. So that means there's a 20% failure rate, which means 1 out of 5 fail. That's pretty high for something, although 4 out of 5 don't. Now, how do you get that better? It's education. A lot of doctors will talk to the patient and let them know exactly what they shouldn't be doing, like lifting their arm up before the bone is healed, reattached to the shoulder. And that's active lifting it up, and then there's also something called passive, where you can use your other arm to lift it up, which is okay to do sooner for a rotator cuff tear repair, but not this one for about 5 or 6 weeks till after surgery. So you want to ask the questions, but it's the doctor's responsibility, obviously, to let you know what you have to do. You want to know about the duration of recovery. Do you need assistance at home? This is for any surgeries. Will there be disability? For how long? Do I need therapy? When will I be able to go back to normal activity? These are questions that are important for any surgery. Again, we all know this. Sports are fun. The goal is a pain and injury-free, balanced fitness program for all ages.